Hey, do you have the chart for?
Yeah, I actually do. Hold on, let me pull up that. Okay, so let me show you what happened. The vital signs were stable. She has no history of heart disease.
Okay.
She was complaining of right-sided chest pain for the past 2 days.
Okay.
But when she initially came in, there was no pain. She had no pain at all. So I just followed.
So when she came in, what was her only complaint when she came in?
She just said she was complaining of right-sided chest pain for the past 2 days. But initially, at that moment, she didn't have any chest pain.
Okay, so she just came in and said, I had chest pain basically 2 weeks ago. And from there, what do we do?
I went ahead and did the assessment
Okay.
when it was her turn because
Okay.
it was an emergent situation. So.
Okay, great. Okay, so I see that. Okay, so
Complaining.
okay, so you followed hospital protocol.
I followed everything.
All right, great.
Okay.
We have that.
I have like 6 more patients, so.
Okay, no problem. We'll get this going. I'll talk with her, and then we'll go from there.
All right.
Okay.
Thanks.
All right. Hi, how you doing?
Oh yeah,
how you doing? Hi, once again, my name is Derek. I'm Derek Bath. I'm your nurse manager for the court. I went over your chart and looked through the chart, and actually everything that was done was per hospital protocol. So basically, your mother came in. She was complaining of chest pain 2 weeks ago. So she wasn't having any chest pain at that particular time. So for an emergent case, they're not going to see you right away because it was chest pain 2 weeks ago versus chest pain right then and there. So and that's hospital. Everything that Nurse Joy did was hospital protocol. So there was nothing that was done improperly. Looking at all the charting, everything was done the way it was done by hospital protocol.
Okay. Well, thank you for reviewing it. Thank you for your time.
Yeah. Do you have any questions or anything?
No, she just needs to rest. Thank you.
Okay. Listen, do you have any questions at all for me?
No,
You don't?
Thank you.
Okay. Ms. Gladys, do you have any?
No, I'm
questions
fine.
for me?
Thank you, sir.
Okay.
Thank you.
Great. Thank you. I'll see you guys later. Bye bye.
Yeah, that was crap. I'm gonna call the vice president. The vice president's office, please. Okay. Hi, this message is for Vice President Bonus. My name is Kalechi. I'm here with my mother in room 207, and I have a formal complaint that I'd like to file with you. My number is 973-555-2144. Thank you.
Can't believe this thing is happening today.
This patient.
Good afternoon, Mr. Smith. How are you doing today? I need to see both of you in my office now. Please.
Oh, yes, ma'am.
About her mother and the treatment here, and I'm very disappointed with the news I heard. We're going through magnet status right now. We're trying to obtain it, and JCO come next week, so I'm not happy with the information I have here. So, Joy, I'll ask you one question. Would you have treated the patient any differently if it was a man?
Absolutely not. I followed the hospital protocol per non-emergent care. Right here I have exactly what my assessment was. Her vital signs were stable, like I told my manager here. She had no history of heart disease. The only thing she was complaining of was right-sided chest pain for the past 2 weeks, but honestly, she had no initial pain when I first took the assessment. So I just followed what was supposed to be proper for protocol.
So I've heard your side of the story, so I'm just going to invite her daughter in so we can hear her point of view, and then we can get this matter situated, okay?
Yes.
All right. Ms. Kalechi?
Yes, ma'am.
Can you come in, please?
Thank you. Hello, nurse.
Let me introduce you to myself.
Hello.
My name is Rachel. I'm the vice president.
Nice to meet you.
And I'm sure you're familiar with the cases you have here.
I am.
So what's your concern today, ma'am?
Well, I'm sure you guys have discussed this, but it was just the way my mother was treated in your hospital. I felt that as maybe if Nurse Joy took her job more seriously and took my mother's illness more seriously, my mother wouldn't have needed the surgery.
Okay. Well, I extend my greatest apology to you and your family, and I understood that everything right now is being assessed. We take situations like this seriously in the hospital, so we assure you that a full investigation is going to be carried out, and if you have any questions, feel free to call me. I'm so sorry that this matter happened to you. We at the hospital, we value patient care. We put patient first, and I'm just really sorry that you had to go through this. So if you have any questions, feel free to call us and let me know personally.
Okay. I would also like to apologize for any misconceptions you may have had as far as me treating your mother with gender bias, because that was not my intention at all. I was honestly just following the hospital protocol and made sure that I had some kind of literature to back up what I was doing, as well as the support of my manager.
And we here at the hospital also have a team of cardiologists and an ethics committee that sit down and discuss this, so a situation like this should never happen. So again, I give you my deepest apology. If you have any questions, here's my card, so feel free to call me. And again, I'm sorry for what you have gone through with your stay here at our hospital.
It's okay, you know, looking back, I may have only questioned the matter of the form. Maybe I didn't stress exactly how soon I wanted my mother to be treated, and I do apologize if, you know, I was a bit, you know, brash with you guys, but you only get one mother, you know, so I appreciate you guys coming together and handling this, and if there is any other issues, I will let you know. So thank you.
Thank you.
You're welcome.
With open lines of communication, Vice President Rachel has managed to save her hospital once again. Kelechi and her mother Tiffany were discharged with no further complaints. This result can often be called service recovery. Nurse Joy has managed to dodge the fire once again, but how long can she keep her relationship with Dr. Caleb under wraps? What you have just witnessed is fictional. Any names, places, and characters are all fiction. Any relationship to real individuals is not the responsibility of the writer. No alcoholic substance was actually consumed during the taping of this episode. All individuals seen are actors and do not play healthcare workers in real life. Stay tuned to the next The Young and the Stressed.